Good afternoon, and thank you for joining us. Today is Tuesday, January 25th, and on today's briefing, we'll hear from Milwaukee County Executive David Crowley, Mayor Cavalier Johnson, Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Chief Health Policy Advisor with Milwaukee County, and Dr. Smriti Curry, President of Primary Care with Children's Wisconsin. Thank you all for being here, and County Executive Crowley, I'll hand things over to you.
Well, thank you so much, Catherine, and good afternoon to everyone. So as we continue to see COVID cases surge in our community, I want to continue to remind everyone who are watching or are going to be listening that we all have a part to really play in helping to stop the spread of this virus, as well as future variants. But one effective layer of protection that we have against the virus is masking. You all know, we talk about it all the time. We know that wearing a well-fitted mask helps to slow the spread of COVID-19. And I want to say thank you to Governor Evers and to the state of Wisconsin for allocating to Milwaukee County more than 600,000 N95 masks, which we received actually late last week. But just under 200,000 of those masks were distributed by our Office of Emergency Management on Friday to various municipalities who we actually requested supplies. We're happy to hear that many of the municipalities who've been able to get those supplies have been able to get those supplies out to the residents that they serve. And so for mass distribution information in your community, we are asking you to check your local health department social media channels for any updates that you're looking for. We know that there is a high demand for high quality masks, and we want to again say thanks to the state as well as our community partners for their help in allocating and distributing these masks throughout our community. And so Milwaukee County's Department of Health and Human Services is also distributing masks for residents who use our county senior centers, as well as individuals that receive Meals on Wheels, which services approximately about 1,000 homes. And so this effort really builds upon the support that DHHS has continued to provide to community agencies throughout Milwaukee County since the beginning of this pandemic. And they're going to continue to work with community organizations to order cleaning supplies and other PPE to assist in the mitigation of the spread of this disease. And so now with significantly more supplies available to us, we're actually able to expand this operation to make masks available for our staff as well as community members, but as well as all the other community organizations throughout the county. And so in efforts to ensure that the equitable distribution of masks is happening in our community with the remainder of the supplies that we have allotted, we did a survey that we sent out last week, Friday, to about 1,000 community service organizations to really determine how many masks each organization needs. And we'll have a third-party vendor working with Milwaukee County to help us fulfill these orders from organizations all around Milwaukee County. And so community providers that are serving vulnerable county residents, whether we're talking about churches or food pantries, we want to encourage you all to reach out to the Milwaukee County Department of Health and Human Services in order to order masks. And the department will work with you to make sure they're routing your orders throughout this process. And although there is no deadline to order masks, we are distributing this on a first come, first served basis or until all the supplies have particularly run out. And as we continue to talk about mitigation strategies, we know that testing is just another tool that we have in the toolbox as it relates to reducing the spread of COVID-19. So I want to remind folks that the federal government has tests available for free for every household. And so if you're interested, go to covidtest.gov. Again, covidtest, TASTS, to order your test right now. There is a limit of 4 tests per residential address. And so tests can typically take between 7 to 12 days to ship to you once you order them. So if you want to test, don't wait until you have symptoms. Order your test now, so when you are ready to take a test, you have that test available to you. And lastly, what I would like to touch on is that we know that getting vaccinated and boosted are our most effective tools that we have to mitigate this virus and really do what we can to put this behind us. And so that's why one of the reasons why last week, Milwaukee County, we've updated our COVID-19 vaccination policies to include mandatory booster vaccines for employees in high-risk facilities. And when we think about high-risk facilities, this includes our Milwaukee County Jail. This includes the House of Corrections, the Youth Detention Center, and our behavioral health services. And so anyone is eligible to receive their booster shot 5 months after their second dose of either the Pfizer or the Moderna vaccine, or 2 months after they've received their single dose of the Johnson & Johnson vaccine. And so to be compliant with the updated mandate, employees, contractors, and volunteers at high-risk facilities who are eligible for the booster shot must receive their dose by February 4th, 2022, or 21 days after becoming eligible. So mandating booster vaccine doses in high-risk facilities is not only about protecting the health and safety of the well-being of the individual receiving the vaccine, but it's also about protecting those that we serve in these facilities. But it's also to provide that enhanced flexibility as it relates to managing the effects of COVID-19 on the Milwaukee County workforce. So employees who are not compliant with the updated vaccine mandate will be ineligible for voluntary overtime or risk recognition pay and or premium pay differential when it becomes available. And there may also be additional consequences, particularly at the department level. But in order to encourage these individuals to get their booster vaccinations, we have launched a new program called Boost More MKE County. And this is a recognition program for our employees who have verified their COVID vaccinations and received their boosters. And so between now through May 11, 2022, all employees who would submit one form of proof of their booster vaccine will be entered into a weekly incentive prize drawing. And so each week, at least 2 employees will be selected to receive a $250 reward. When it comes down to the health and safety of our residents and our staff, this is our top priority right now. We want to make sure that everyone is safe. And so again, we want to continue to encourage everyone out there to please do your part to keep our community safe, your neighbors safe, your family safe. And that is get vaccinated, let's get boosted, let's wear a mask, and let's wash our hands. And more importantly, if you are sick, please stay at home. So again, thank you for tuning in. And I'd like to hand it over to Mayor Cavalier Johnson. Mayor Johnson.
Thank you very much, Mr. County Executive. Appreciate all the work that you're doing on this front. Good afternoon, everyone else. On Saturday, as you may be aware, Milwaukee's new mask ordinance went into effect. It requires everyone ages 3 years or older to wear a mask indoors in public places with the exception while being eating and drinking. The ordinance remains in effect until March 1st of 2022, although, and I think this is important to note, that the Common Council could act to end the mask requirement sooner if the conditions warrant. Public safety is my paramount concern, and with the current surge in COVID-19 cases, masking is one of the reasonable mitigation steps that we have available to us. Businesses in Milwaukee, and this I think is known far and wide, have endured significant consequences from the pandemic. And I appreciate all the efforts that they have made to reduce the spread of the COVID-19 disease here in our city as well as in our county. And while masking is an important tool during periods of extreme transmission, Milwaukee's path out of the current pandemic relies on vaccination. That's a point that I've emphasized many times before and will emphasize here again, that the way out of COVID to keep hospitalizations low and to keep people safe and healthy is through vaccination. Too many people in our city are not vaccinated, and that quite frankly just needs to change. Everyone should be masking and distancing as part of their routines, but getting vaccinated and getting boosted, those are also a top priority. Folks should make sure they heed that advice. Our community COVID-19 testing and vaccination sites at the Northwest, the South Side, as well as Menominee Valley sites are closed today due to extreme cold weather. The National Weather Service issued a wind chill advisory for today, expecting wind chills to reach 20 to 30 degrees below zero. It's too cold for staff to safely administer tests and vaccinations outdoors in this weather. I am, though, very thankful for the work that they've been doing, especially during these cold winter months. I passed out masks with staff just a week or so ago, and I can tell you I was relieved when it was time for me to come in to warm up. But the staff, though, they remained on site. They kept on handing out masks far long after I departed. And I want to thank them for their great work. Cold weather is reality in Wisconsin, and our COVID sites will not close unless it is unsafe for them to remain open. You should check the health department's website at milwaukee.gov/coronavirus or their social media channels on Facebook, Twitter, and Instagram as well, prior to visiting a site to confirm if there are any closures at the site that you intend to visit. If you need COVID-19 testing and vaccination, please visit healthymke.com for other available locations in the area. There are many COVID-19 sites that are indoors and able to be used during these periods of extreme weather. So let me repeat that. There are many COVID-19 sites that are indoors and are able to be used during periods of extreme cold weather like the ones we're experiencing now. The Menominee Valley site will reopen tomorrow from noon until 6 with increased staffing to handle any increased demand. Our Northwest and Southside health centers are closed on Wednesday as part of their regular hours. An update now on our COVID-19 gating and metrics for the week. We remain in the extreme transmission category. We remain in the extreme transmission category for COVID-19 cases per 100,000, down 778.3 cases per 100,000, and our percent positivity rate also remains in the extreme transmission category, down to 21%. Our vaccination rates, 61.8% of City of Milwaukee adults, those are individuals 16 years of age or older, are fully vaccinated. 67.3% of adults have received at least one dose, and 41.1% are fully vaccinated with a booster dose. I'm relieved to see that our cases are trending down from the record highs we experienced just after the holidays here in Milwaukee in our area. While this is a promising sign, we still remain in the extreme transmission categories with vaccination rates that are just far too low. We must continue to exercise caution and get our vaccination rates up in this community. Finally, I want to remind residents that the health department is partnering with Milwaukee Public Schools to provide vaccines through school-based clinics. So far, the health department has distributed 382 doses of vaccines at these sites. We want to continue to vaccinate as many staff, students, and parents, members of the community, both children and adults, as possible. Although these are school-based clinics, they are open to the public for walk-ins from members of the community. Here's a brief summary of the mobile vaccine clinics for this week. So today, January 25th, from 2 to 5, there'll be a vaccination clinic at Hayes Bilingual School. Tomorrow, Wednesday, January 26th, from 10 a.m. until 2 p.m. at the University of Wisconsin-Milwaukee. From 1 to 4 on tomorrow, Wednesday, January 26th at Ascension All Saints Family Health Center. On Thursday, January 27th, from 2 to 5 p.m. at Rocket Ship Southside Community Prep. And on Friday, January the 28th, from 9:30 a.m. until noon at Milwaukee Academy of Science. An additional one on Friday, January 28th, from 1 o'clock until 4 o'clock at Our Avenue School. Vaccines and boosters are also available at the health department's community locations at the Northwest, South Side, as well as Menominee Valley sites. The full schedule of school-based clinics can be found at milwaukee.gov/COVIDvax. So thank you very much. And with that, I'll pass along to Dr. Ben Wesson.
All right, thank you, Mr. Mayor. Good afternoon. First to our numbers, we're currently seeing in Milwaukee County an average of 975 new cases per day and about 8 deaths per day. So while cases are falling, deaths are rising. Data indicate that we are turning the corner on our COVID-19 disease burden from Omicron. Our cases and positivity are showing a sustained downtrend, and that's matched by statewide data, as well as that from other states, more generally in our region. And this does correlate with the timeline that we've seen in other parts of the country and other countries with respect to that rapid rise followed by the fairly quick decline in Omicron cases. Now, that said, it's important to keep in mind that we are not yet past this surge. Even on the decline, our cases continue to be at record numbers, as does our positivity. And as we've seen throughout the pandemic, cases fall before hospitalizations, which fall before deaths. And that's no exception here, as we see very high numbers of COVID hospitalizations still, and continually rising numbers of COVID deaths. We're not out of the woods yet, which is why continuing mitigation measures, including using high quality masks, such as KN95 or N95 masks when indoors, distancing and ventilation continue to be critical. Milwaukee County has worked to stay ahead of the curve with targeted interventions and resources to our most vulnerable populations as we fight the pandemic. As the county executive mentioned, we have been and continue to distribute masks throughout the community, with a particular focus on our most vulnerable populations. Partnerships formed by the Milwaukee County Department of Health and Human Services, as well as Milwaukee County Parks for months with different organizations, including the We Care crew and other provider networks, has provided high quality masks to heavily impacted communities. Now, of the layers of protection against this virus, none is more critical than the vaccine and the booster. But misinformation persists about the effectiveness of the vaccine and the booster against COVID. Now, last week, the CDC released data from a network of over 250 hospitals across 14 states. And this showed that hospitalization rates were 16 times higher in unvaccinated adults as compared to vaccinated, 16 times. Now, furthermore, data released also showed the effectiveness of the booster shot. For people over 50 years old, those boosted were 44 times less likely to be hospitalized than those who weren't vaccinated at all. And the booster itself, adding the booster to the vaccine series, accounted for 17 times of that decrease in hospitalization. And we've seen similar data across all age groups. The vaccine and the booster prevent severe disease. And to counter another frequent point of misinformation, the vaccine also prevents you from getting COVID infection in the first place. Of course, breakthrough infections can occur, but if you're vaccinated, and especially if you're boosted, you're substantially less likely to have a breakthrough infection and test positive for COVID than those who are not. The simple truth has been demonstrated by study after study after study that the vaccine, especially when coupled with that booster, decreases your risk of infection, decreases your risk of severe disease, prevents hospitalization, and certainly prevents death. And it decreases your ability to transmit the virus to others. So this is why getting vaccinated is critical for you, but also for your family, for your coworkers, and for your community. This current wave of disease is finally declining, but the future of COVID remains unpredictable. The best path forward to keep yourself safe into the future and to bring an end to the pandemic is through vaccination. Thank you and stay safe, and I'll hand it to Dr. Kari.
Thank you, Dr. Weston. So at Children's, I think we are continuing the theme of saying that some of the Omicron burden seems to be easing in our outpatient settings, like in our primary care clinics and our urgent care and emergency room. However, we still are seeing a lot of positive children and still continue to have upwards of 20 or so kids who have a positive COVID test in our hospital setting. Now, not all of them have been admitted for respiratory illness or COVID illness. Some of these are unexpected positive tests when they've been admitted for other things. But that number still continues to be high, and it is something that we're monitoring closely. This isn't surprising, as we know the numbers in the community are as high as they are, as just the disease burden is higher in the community right now. So it's not surprising that we're still seeing some positives in our kids. To sort of follow up on that, the message that vaccination is important, we are a little concerned that the vaccination uptake in the 5 to 11-year-olds is not as high as we would like it. Only about 24% of the kids in the state of Wisconsin have been vaccinated in that age group. And so, as Dr. Weston impressed upon us, vaccination is one of the best tools that we have against COVID disease. And so really encouraging the children to be vaccinated is a driver for us. We're looking at all ways that we can communicate with our kids and with school districts to encourage vaccination. The more kids are vaccinated, the more our community is protected, the more they are protected. It's often talked about that COVID is not as bad a disease for children. And I think that is simply considering the acute hospitalization and deaths that have happened in adults. That percent is definitely more in the adults, but there are so many other ways that COVID has impacted our kids. Probably the area that we worry about the most is the mental and behavioral health of our children. This was already in a crisis prior to the pandemic, and we have seen a significant rise in children struggling with anxiety and depression, post-traumatic stress disorders when they've had a family member critically ill or passing away from COVID. And so we are very concerned about our children's mental behavioral health needs at this point. In addition, we know our educators are very concerned about reading and math and language skills and social connections for our kids and all of the services that schools provide and the disruption in that. And so all of these things have significant impact on kids. Some of the newer research is really playing into the area of long COVID or COVID-related illnesses that are showing up. One of the things that we're watching very closely is some reports emerging that show that there might be an increase in new onset type 1 diabetes in children. And so those are early reports that we're watching very closely. The CDC did put out some information on this for all pediatricians to be aware of that. We have in our own offices seen a lot of children with impact of that long COVID, where we're seeing things like chronic fatigue, brain fog, anxiety, body aches and joint pains. And so all of those are things that we're watching closely. And I always want to tell people that we are watching very closely for the Omicron surge associated post-COVID things that could happen. The multi-system inflammatory syndrome, which is that critical illness that children can have after a COVID illness, usually shows up 4 to 6 weeks after your primary COVID infection. And so we're watching that very closely with the Omicron surge and watching the numbers for that as well. So really at the end of the day, kids are impacted differently, but I would say still significantly impacted. And it's really important that we can do everything that we can to decrease the numbers for COVID in the community. Vaccination obviously being the biggest tool, but always wearing a mask, not being out when you're not well, washing your hands, all of the things that we remind our kids every day are so important to be able to come on the other side of this. So, thank you. With that, I'll return it back to Catherine.
Thank you, Dr. Kari. We'll now move into the media Q&A portion of our briefing. Our first question comes from Will Cushman with PBS Wisconsin for Dr. Weston. He says, how does wastewater surveillance for SARS-CoV-2 help inform the pandemic response in the Milwaukee Metro, if at all? Do you see this surveillance playing a useful role in the future, and or how could it be more useful as a public health tool?
So the sewer shed data has certainly been interesting. We have 2 main sewer sheds in Milwaukee County. The way that this works is scientists collect water from the sewer sheds and then test it for fragments of the virus. And so when you find more fragments, you assume there's more virus in the community. And this has held up pretty well when you look at the data. A lot of times the sewer shed data precedes by a few days or even a week the data that we're seeing in the community. So it can certainly be a predictor of what's going on in the community. So I think there's 2 uses for this. I think one is real-time data monitoring, understanding how well it correlates with our case counts and our positivity rates. I think into the future, once we get into more of a surveillance mode with COVID, which remember the acute phase of the pandemic is not forever. So once we get into that more surveillance phase, watching for variants to crop up, watching for areas of the community to have higher disease burdens, the sewer shed data will be really valuable to monitor that and watch it and see when those increases or those spikes occur.
Thank you, Dr. Weston. Our next question is for Mayor Johnson from Rich Rovito with the Milwaukee Magazine. He says, your predecessor often stated that he felt the pandemic played a role in the city's escalating homicide levels. That certainly seemed plausible in the early part of the pandemic when there was an extended shutdown, people were isolated, and unemployment skyrocketed. Now, unemployment is at record lows, there is no lockdown, and people aren't as isolated, yet the level of violence shows no sign of subsiding. What role do you see the pandemic having in the increasing levels of violence in the city?
Yeah, that's a great question. And look, I think that many people in Milwaukee face a daunting combination of circumstances and have for quite some time. There certainly are the pandemic pressures, right? There are economic pressures, there's emotional trauma, there's hopelessness, and you add to that a sharp, increase in the availability of firearms that too many people who should not have them in the first place have too easy access to. All those things, I think, help to contribute to an environment conducive to violence spilling out in the street. That's why I think it's incredibly important for us to be leading Milwaukee to a place where it is stronger, where it is safer, that is healthier, and it's more prosperous for everybody, so that you see these levels of violence going down.
I might just add to that, Mr. Mayor. I agree with everything you said. And also, when we look at our 911 system, 14 different fire departments, 100,000 patient encounters per year, we still see a lot of struggles with mental health in the community. When we compare December 2021 to December 2019, before the pandemic, we see our psychiatric calls, our suicide calls, our overdose calls are still nearly double what they were before the pandemic. And so I think it just goes to another point. We're not done with COVID yet. We're not done with the pandemic yet. And mental health is one of the major issues that goes hand in hand with that.
And I would just have to add on, I agree with the mayor as well as Dr. Weston. I mean, when we think about COVID-19, we always think about the immediate stressors, but this is still new to us. We're still within this thing. We're still haven't been a full 2 years yet. And we really don't understand the long-term effects this pandemic is going to have on us physically or mentally. And so we have to take that onto consideration as we think about how we are responding as a society to many of the things that we're seeing.
Thank you all. Our next question is from CBS 58 for Dr. Weston. They want to know, what do you know about the subvariant of Omicron called SBA2? What are you concerned about it?
So BA2, so this has been a variant that's been seen mostly in Western Europe. It seems to be an even more transmissible variant than BA1, which is kind of the Omicron that started everything off. Whether it's going to be impactful on a clinical level, on a patient level, on a community level, is hard to say. It certainly seems to be outcompeting as far as transmissibility, but whether it has more severity, whether the immune profile changes, and whether that really makes a difference for communities is yet to be seen. We've seen many, many variants come up. Certain ones obviously are quite concerning and impact the community, Alpha, Delta, Omicron, obviously. But whether this variant will fall in those pathways or be less significant as compared to Omicron is yet to be seen.
The last question I'm seeing in the chat comes from Chuck Kornbach with WUWM. It's for Dr. Weston. He says, can you please give more details about the COVID deaths in the county? What demographics, age, specifically latest deaths the last week or two?
Yeah, we can certainly dig into that and get that data to you. I don't have it in front of me right now.
Excellent. I'll give it just one more minute to see if there's any final questions. Otherwise, that would conclude our briefing. If you have any final questions, please put them in the chat for our guests. All right, seeing there are no further questions, that concludes the briefing. Thank you all for joining us, and we will see you next week.
Thanks, everyone.
Thanks. Have a great day.